Welcome back to Western Medicine, Talk 1260 AM KTRC. This is Daniel Ronel talking about plastic surgery with my wife, Betsy Ronel. What?
We are sponsored now by Artifil. I was trying to tell you to say that. Anyway, thank you so much, Mark, for telling us how to stay thin. Tonight, when I eat my dinner at 8:30, I'll be thinking of you. Okay, so now we're on to our hot topics again, Doctor.
Yes.
I want to talk to you hot topics for men. I've got my current, once again, New Beauty issue. Fantastic magazine. I swear to God, this is one of the most informative magazine issues I've ever read in my entire life of reading magazines. Okay, so we've got some common procedures here that I'm calling hot topics because they are somewhat fads, perhaps. Maybe not. All right, one of them, this is very questionable, and I've seen this on the plastic surgery TV shows and stuff like that, and I've also just read about it, heard about it. Calf implants.
Okay.
What are your feelings?
I think there's definitely a role for calf implants in some men. I personally don't do them because I think the complication rate is too high in my hands. There are some plastic surgeons out there who do a fabulous job and they don't get complications, but in general, the overall trend is that the complication rate is really high. And when somebody has a complication in their calf, it can be devastating. Oh. It can lead to bilateral knee amputations, below the knee amputations, or not just removing the implant and then leaving a soft tissue defect that's even worse. But so for me, I'm not too hot on them. Right, you have to find the right people who do them, and there are doctors who do very many of them, and they have great results, and so that's to whom I would refer them.
Do orthopedic surgeons do these?
Not that I know.
Oh, okay. I was just curious because you know how some ENTs do Botox and stuff. Right. Okay, so all right, on to the next thing. How about neck, chin? That's a big, it's interesting, more so in men than women. That's an area that I really see falling apart.
Right, so the way to rejuvenate that is to do a neck lift or a chin implant or both. And in fact, the traditional neck lift pulls the neck skin behind the ear, which I'm not a fan of. I was trained in that way, and I think it leaves a big ugly incision behind the ear. And I think the best way actually to lift the neck skin is straight up, because the neck skin never came from behind the ear, it came from higher. But no matter what you call it, there's a facelift, and a lot of people just can't tolerate the concept of having a facelift if all they want to rejuvenate is their neck.
Right, they can't separate the two
mentally. I think this is all one. Right, I think the cheek and the neck are truly one anatomical unit, and the best way to address the neck is to do the whole lift. However, I will, I can do the traditional neck lift, which pulls it behind the ear, and it looks great. I just think the scar is big.
Well, but scars fade, and maybe that's it's really more of a psychological thing, because when you're looking, like right now, I'm looking at your cheek, going into your jaw, going into your neck. It is one slab of skin.
Yes.
So it's really just a psychological thing. Oh, I'm too young for a facelift, and I totally get that. Men and women both say the same thing. Oh, I don't want a facelift. I just want my neck fixed.
Right. The other big thing, like you were talking about before, is a chin implant, and that can be really a very powerful, and that's a pretty easy procedure. I want one. You said it was not easy to me. I think for what you want, you want the whole thing from one angle of jaw to the other.
Christy Turlington. Okay.
And so I think the myth is that you can get back out into the real world within a week. Perhaps if you're lucky, but in reality, it's a pretty traumatic procedure to put in a big chin implant. It does affect the muscles of the smiling muscles and the sensation in your mouth, and you can stay swollen for a couple weeks. And so I just did somebody about 2 months ago who's a singer, and he sings in his church in front of several thousand people. He's still having difficulties mouthing some of the
but that with stimulation and time will come back.
I know, of course it is, and it is getting better. And he says it's actually interesting to him to try to to compensate for that. So my point is, chin implants are great. They're a pretty simple procedure to do, but the recovery time is not just 1 week. You do need to set aside, I would say, about a month.
My God, but I really thought that you did that in the office.
Some people do it in the office, but you really need sedation, and to do sedation, there are many levels of office procedures, and I do certain things in the office that don't require people to be knocked out.
Right.
But to get a true chin implant, I think you need a bit more sedation than I'm comfortable doing in my office for now.
I get it. So you're saying that a way to rejuvenate the neckline, the jawline, is a chin implant.
Chin implant, a
and
neck lift.
Or,
and if your neck is not that saggy, just neck liposuction.
right. Okay, so we're done with that. Now, let's discuss skincare products. Do men use a lot of that stuff? Because, yeah, let me know.
I've got
Lay it
about 10
on
of them on my shelf, and I don't even use them. I mean, it's really hard to convince a man to use them, but, you know, we need to. I need to. I
Okay.
should. We need
Just a
sunscreen.
second, just a second.
Okay.
What if about a man who's just put all this time and money into rejuvenating himself?
Of course.
Are they more likely to use these products? Or not?
Slightly more likely, yes. They want to protect their investment and keep their skin looking good, but, you know, men, you know, we just don't like to spend a lot of time.
Oh, really? All right. So, what are the favorite skin products, or what are the
Okay,
best
you get-
ones that you think men would be likely to use,
Gotta have
and that are the
sunblock.
best? Can I just finish?
Okay.
The men that men are most likely to use, and that are the most effective. Give them the most bang for their buck,
Number one is a sunblock. Anything that they use has to have a sunblock.
especially in Santa Fe.
Right, if they're going to use one thing, it's a sunblock. The next one is after we shave, for those people who do shave, you got to have something to protect the skin after that, because shaving is traumatic. And there are great things out there that sort of smooth out the skin.
I think
for the
men know
moment.
about that stuff already.
Okay, but now we're talking already 1 or 2 products, and that's about it. We're not going to be doing
What
very
about
many more.
moisturizer? Think of Marion.
Yes, moisturizers are
7
important.
layers.
I just don't see us carrying around moisturizers during the day and putting them on.
Nobody
in the morning.
does. I mean, women reapply their makeup, I guess.
And so
but
the best is a combination thing. Nia 24 makes an excellent product, which is a moisturizer and a sunblock.
that's really great stuff.
I actually
Right,
happen
so-
to love that stuff. It was developed at the University of Arizona to prevent skin cancer, and it's the only thing out there that actually helps prevent skin cancer.
It even lightens up. One of my results has been
Yeah,
that it
you
lightens
like
up
it.
my skin spots.
Yeah, anyway,
Or
so
at least I
that,
think it does.
that's an example of, of something that men should be using, which is a combination moisturizer sunblock.
So Nia 24. Some people pronounce it Nia 24, but it's Nia after niacin. Nia 24. Okay.
Yes, it's got
yeah,
niacin
that's good
in it,
stuff.
right.
Okay, and so here that brings me to another topic.
Mm.
What about laser hair removal for men?
Very popular for the torso. It takes a couple treatments because the hair's got to go back, then you zap it again.
Men have thicker hair though, don't they? Than women or not?
Yeah, sometimes they do. What's important is the difference in color between the hair and the skin.
Right.
And with the color hair, right, a redhead is going to have a tough time getting rid of their hair. But one thing that's nice is we have a laser with a very big, wide head, so you can zap a lot of hairs at once. So.
And they do their torso for what? For sculpting?
It's for aesthetic purposes, just because
Right.
it looks good.
Do they ever do, you know how some men have a unibrow? Do they ever do that?
No, you do not do laser hair removal
Oh,
on the
that's
brow.
right.
No,
Yeah,
it's too,
right.
the skin is too sensitive. Technology is coming out that's going to allow us to do that, but it's
Oh,
not yet ready.
women would kill for that.
Okay, but now we're plugging. All right.
All right.
You have been listening to Talk 1260. We're wrapping up this show. We've been talking about men. We've been talking about the hot topics. We had a great nutritional tip
Oh, yeah.
from Mark. Thanks so much
Thanks
for listening.
again, Mark.
We'll be back next week on Talk 1260 KTRC Western Medicine, sponsored by Artifil.
If you have any questions about what you heard on today's show or any previous show, feel free to give us a call at 982-2440, or you can look at our website, www.danielronelmd.com, or email Dr. Ronel directly at info@danielronelmd.com. Right?
That website was made by Studio X, one of my favorite local
yeah, they're great
developers.
people.
Yes.
So we love hearing from you. We've gotten some terrific emails personally, and we've also gotten some feedback on our YouTube videos. We love hearing from you. It makes the show what it is, and it makes us serve you better. So keep them coming. Thanks for listening. We'll see you next week.